Hello, my name is Cynthia Campbell, and I will be presenting a presentation on urinary incontinence, reducing with therapy. How many incidences can you recall when you have sneezed, coughed, laughed, or lifted a heavy object or had a certain urge to urinate that caused accidental bladder leakage? Involuntary leakage of urine are signs of urinary incontinence. Studies report that 38% of women will experience urinary incontinence sometime during their lifetime. With increased age, the frequency of urinary incontinence also increases. Women over 45 show a 45.5% increase in urinary incontinence, whereas women over 75 reported a 54.5% increase. In this brochure, you will also find the same information that will show you the information that is being presented in this PowerPoint. At the end of the presentation, you will find that copy. Types of urinary incontinence. There are three. There are stress, urge, and mixed. Stress incontinence is caused by obesity or childbirth that has weakened the pelvic muscles and triggered by coughing, laughing, sneezing, or other strenuous activities. Urge incontinence is frequent urges to urinate related to an overactive bladder. Mixed incontinence results from stress and urgency together. There are misconceptions about urinary incontinence. Urinary incontinence is not uncommon. It's more common than you think. Most women do not advise their providers that they're dealing with urinary incontinence, so it goes undertreated, underdiagnosed. There are treatments for urinary incontinence that do not involve surgery or medications. And urinary incontinence is a part of aging. It is not. There will also be a presentation of this, which is the self-assessment for urinary incontinence, included at the end of the presentation. The exercises involve strengthening the pelvic muscles. In order to do this, during urination, you want to squeeze the pelvic muscles to stop the urination flow and hold for a few seconds. Then release and repeat the process. And this should be done at least 10 times per day and should be increased in duration and frequency. For urge incontinence, this involves bladder retraining. The goal of this is to stretch the bladder. When you have the urge to urinate, you want to try to hold your urine for up to 5 minutes. Then you want to relieve yourself. Upon the next time that you feel the urgencies to urinate, you want to try to increase that duration from 5 to 10 minutes. After each go, you want to try to go up to 30 minutes. For mixed incontinence, you want to use both the trainings for pelvic floor and bladder retraining exercises. Included inside of at the end of the PowerPoint will be a copy of the exercises for bladder training and pelvic floor muscles exercises. Goals and tracking progress. Use the bladder training diary to keep track of your progress and goals. At the end of the presentation will also be a copy of a bladder diary. Here are my references. Also will be included at the end of the presentation is a Likert scale for you to make a evaluation of the presentation. This is a copy of the brochure. This is the self-evaluation for the urinary incontinence. copy of the pelvic floor exercises and bladder training, the urinary incontinence bladder diary, and the Likert scale for the evaluation of the presentation. Thank you.